On TV, you're not getting video.
That'd be fun.
Hi everyone, I'm Dr. Riz from Islands Pediatric Dentistry in Gilbert. Today I have Denise and Babette with me. Babette is 5 and we met her 6 months ago, and we're going to talk about thumb sucking or finger sucking habits, because she had a very strong thumb sucking habit and she couldn't fall asleep without sucking her thumb, and this was really pushing her bone and the upper teeth out and pushing the bottom teeth in and really changing the bone in her upper jaw and lower jaw, which is significant if we don't stop it by age 6. So she's 5 now. We saw her 6 months ago. Mom, you had already tried many options as far as getting her to stop, and unfortunately we're unable to do that. So we made this appliance, what we call a thumb sucking appliance, that stays in and gets glued in for 6 months. So now Babette is back after 6 months, and I'm so happy to get some feedback from you. So kind of bring us up to speed. How was her reaction after the appliance was glued in or cemented in 6 months ago?
Okay.
How was her reaction?
She was sad because she couldn't put her thumb in her mouth. So for probably the first week, she had a hard time falling asleep at night, just because the habit of putting her thumb in her mouth. Yeah. But we bought her a new stuffed animal so she would have something to sleep with, and within 2 weeks she wanted the appliance out. But I told her, let's make sure the habit is really broken. So it only took a few weeks for her to really not have the desire to keep sucking.
And that's what we see most of the times. Most of the times parents tell me that 2 weeks or a month was what they took for the child not to want to put it back in there. But we always like to leave it for the full 6 months, because if I take it out and they start again, we want to make sure that the habit is fully broken. But emotionally, she wasn't too devastated, crying, pain. What was her pain level? Was there any pain?
There was no pain. No pain at
Fantastic,
all.
fantastic. And now we're seeing her today, her upper teeth have moved down a little bit. Because for the past 6 months, nothing has been pushing them up. And I'd like to show you what the appliance actually looks like. Can you see what the appliance looks like? Can you see it in her mouth? Because today we're going to take it out for her, and she's super ecstatic, right? Are you happy to have the appliance out, baby? I'm so happy for you. You're such a big girl. Give me a high five. We're going to take it out for you today, okay? And you're not going to suck your thumb anymore, right? Thank you for it. You're such a cutie. So there is a solution for this. Most of the times we try to get the kiddo to stop sucking the habit by just encouraging positive enforcement and just reminders and stickers and prizes or nail polish. But sometimes we know with all of our best efforts, even with the thumb guard, still we get to a point where it's just not happening.
Right.
And we know when we get to this age 6 and those permanent teeth come in, then it's going to be permanently reshaped, and you're going to need braces. And you were telling me your two older kids, right?
My 2 older daughters both suck their thumbs, and now they both have to have braces.
And how old were they? Well, how old are they now?
They're now 14 and 16 with braces.
So a simple appliance can save you thousands of dollars.
Yep.
And hopefully that'll be the case here for her as far as braces. Again, I'm so pleased with how this turned out. And if you or you know anybody who has this issue, Islands Pediatric Dentistry, 602-491-1818 will be happy to help you. Love you. Hey, good job, baby.